Afternoon, everybody. Welcome to our Digital Pharmacy Council launch webinar. We'll give people a few moments. So I can see there's a lot of people joining at the moment. So we'll just let everybody filter in and then I'll come back to you in a moment. Got scores of people joining us, so I'm just going to let all of those come in and it won't keep beeping as we move on. We'll start shortly. Jenna, you were the magic 100 joining. Okay, we're a couple of minutes in. I think most people are with us now. Nice to see Ramdeep join us and Darren as well. I will just introduce myself and the rest of the panel, and then we'll go into a short presentation on what this is for, how it's going to help everybody. So my name is Karl Grundy. I'm the Managing Director of Digital Health. I've been here a very long time, so hopefully I've remembered a couple of things about what we do as a business and organisation. Just to give everyone a little bit of context in terms of digital health to begin with, digital health have been around since the inception of the networks. We run a large event called Rewired, which hopefully many of you know. We also run the publishing website, digitalhealth.net. Everything is free and open to anyone in the NHS, the public sector, charities, and private healthcare providers, such as the kind of Ramsay's, Boopers of this world. So we try and be as inclusive as possible. We have been running the networks for 13 years, getting into its 14th year now. Started off with around about 40 people who thought this was a good idea before the term CCIO even existed in the UK. There was a thing called CMIOs over in the States, which was Chief Medical Information Officers. We ran a campaign with a bunch of like-minded folks across the NHS and the industry to launch the role of CCIO and the CCIO network. So although CCIOs are a commonplace now, it was originally a digital health inception and exercise, and I'm really pleased that it's still going strong with lots of new members. I'm going to pass it over to the panel to introduce themselves, and then I'll just go into a little bit more detail about the networks for you. So Marina, if I could pass over to you to begin with, thank you.
Hello, hi everyone. I'm Marina Khan. I am a current clinical fellow at NHS England, and we have come together to create this Digital Pharmacy Council, and which we are going to talk more about here. So thank you for joining us today. Thank you. Over to you, Anna.
Hi everyone. It's great to see so many people join us today. I'm Amna Patel, pharmacist by background and Senior Engagement Manager for Healthcare at GS1 UK. So I'm really pleased, as Marina said, that we're launching the Digital Pharmacy Council today. Shaz, over to you.
Thanks, Amna. Hi, everyone. I'm Shaz. I am a principal pharmacist for EPMA at Walsall Healthcare NHS Trust. I'm also the regional digital chair for the chief pharmacists in the Midlands, in the West Midlands. Again, like everyone else has echoed, it's lovely to see so many colleagues on here. It just shows how important this is, and thank you to Digital Health as well for organising this. Thank you.
Yeah, Rahul may join us later, so we'll miss Rahul's introduction. But I know everyone's stuck for time, so I will crack on. So as I mentioned earlier, we started off with the CCI network. We got a bunch of senior clinicians across acute, mental health, and primary care to give full representation across the market and discuss what digital means to them or what it could mean moving forward. So it became a movement about furtherance of digital within a clinical space as its kind of inception. Started with 40 people. We used to run individual webinars, meetings, and then summer schools for the groups individually. Later on, we started to amalgamate those as new networks were launched. So following closely after the CCIO network was the CIO network. Again, CIO was not a particular popular or well-used job title at the time. There was a lot of directors of IM&T, health, heads of IT, etc. A lot of people who came from records management background within the NHS healthcare service around digital. So there was a lot of change and a lot of digital coming in. Following the National Programme for IT, which was launched way back when, there was a lot of lessons learned and a lot of opportunities for cooperation, collaboration, whether that's someone installing a new EPR system in their locality, others wanting to do the same and trying to understand what they did about it, what was good practice, what was best practice, lessons learned. So hopefully it starts to give you a bit of an idea that this is a community for yourselves. It's not a community owned by a single person, and it's all about what you put into it and what you get out of it. The reasons why we start these things with councils to begin with, and then they move on to advisory panels, is it becomes a collection of people who are prepared to put some skin in the game. And the skin in the game is generally time. So people are busy, but people are prepared to kind of put their time to help their colleagues, their peers, new starters, to see where their careers can go with a focus on digital. We run a number of webinars like this for people to kind of share information. We host speakers from the supply community, from NHS England, and from your kind of colleagues, peers, etc. So you can go into finite detail, whether there's a clinical profession, whether it's a particular technology, it might be about leadership, professionalism, transformation. So those are some of the core topics that we speak about quite a lot. We represent a lot of those topics that are kind of main event rewired, where the stages follow along those lines around digital transformation. So we try and facilitate conversation across multiple facets, both on and offline. We think it's important for people to meet in person as well as online, so people can actually get to see each other, look in each other's eyes, and work together and create those kind of friendships and networks, which are fundamentally important for your kind of careers moving forward. I just add a little bit of kind of context. So after the CIO, we then launched the CNIO, so the Chief Nursing Information Officers. That was becoming more of an established kind of function. That also included midwifery. Then we extended that out to auxiliary health professionals, or AHPs, and various kind of acronyms. There are some kind of pharmacists that joined that as well, who were particularly interested in digital. We also set up the ICS Council when ICS started, just to, again, give them an opportunity to meet and speak to each other, give each other that supportive hand in terms of the development of that as a new area within the NHS after a kind of small restructure within the NHS from the centre. And then we've also set up specialist groups, one of those councils being the CSO group, which is the clinical safety officers. But we also have some smaller groups that aren't councils, aren't advisory panels, things like the Caldecott Guardians are in there. We have cybersecurity groups in there. So there are specialist groups as well. So again, as clinical pharmacists or that kind of wider pharmacy community, this is going to be your community, but you will also be able to interact with the CCIO group, the CIO group, the CNIO group, the CSO group, Caldecott Guardians, if that is your thing and you want to talk about governance, etc., the cybersecurity field, and everybody has access to an open forum, which was in a piece of open source software that is called Discourse. So you hear the word discourse quite a lot through this and over the next few months. It is basically a secure online platform where you can have discussions. So the way that kind of works is let's say I am in the CCIO Council. So I'm a CCIO at the Royal Free. Let's just pick one down in London. And I put a message in there saying that I'm really struggling with getting our document management system to integrate with our patient flow. And some CCIOs can see that message and respond to it and say, oh, we've had a similar issue, or what document management system are you using? What's your EPR? Where's it falling down? And then actually, let's say Marina for a moment is also in that CCI network. She may choose to reply and put it into the open forum. What that basically means is then everyone across all of the networks can then see that discussion and get involved in that discussion. And I've seen it in the past where things like EPMA, before EPMA was EPMA, and it was called things like advanced prescribing, whether it's outpatients or inpatient prescribing. Discussions around how they integrate prescriptions and pharmacy and labs into the system. But you were having this conversation between CIOs rather than clinicians responsible for it, or particular kind of professionals who have that as their kind of expertise, who could have easily have come into that conversation earlier and actually given some kind of cold-faced benefits and expertise to actually help that discussion go forward. So by bringing a fabulous group like yourselves onto kind of discourse, apart from it actually helping your own industry and your own kind of careers, it also actually helps the wider network and everybody working together. People talk about MDTs, multidisciplinary teams. It's easy to talk about them. Actually getting everybody to work together in a single direction is much harder. And things like the networks and Rewired and other events in the industry and other collaborations, your own kind of schools, your own professional bodies, royal colleges, all provide that kind of facility to give you that kind of nucleus of support and opportunities to network and discuss. We always try and set up a council of people who have prepared to, as I say, put their time on the line to kind of provide and help this with people. There's no a council is seen less than an advisory panel, which is less than somebody else. It's not that kind of gig, as it were. It's more about that we don't run elections straight away to give people the opportunity to get to know each other, how it works, but we tend to try and open it up to elections later where there's enough support of that particular network and people are flourishing and using it and getting the benefits from it. Then it comes to an open election where all of the members get to vote for the people that they would like to be on their advisory panel. Then there's separate meetings from that advisory panel, and then another round of elections for people who become the vice chairs or the chair of those meetings. Those chairs and vice chairs will then be grouped with the other networks, who will then have regular either monthly or quarterly meetings or bi-monthly meetings, depending on where we are in the circle of the year, with the centre, with people like Alec Price-Ford, with Helen Balsden, with Wajid Hussain, and so on and so forth at the centre. So there is that kind of two-way integration and conversation and knowledge sharing between the centre and everybody working at the kind of coalface. So we try and facilitate that as much as possible. We don't put any parameters in the way of those things. So hopefully it starts to give you a bit of a trajectory about why we start the way that we do and where things can kind of go moving forward. But you're not, apart from the elections, a bit of extra kind of support from digital health, which is partly a capacity issue as well. So Marina and the wider kind of team will take on some of the kind of note-taking, facilitation around some of the webinars, and then digital health will be there in support. And Natalie, who's on the call, our community manager, is a key person there in terms of making sure that you know your way around the discourse platform, how it works for you, how you can join webinars, how you can suggest things and topics, get feedback, get access to various things, or if you just need a bit of help and advice, and she can hopefully point you in the right direction. It is not a membership organization. You don't need to pay any fees. You don't need to be peer reviewed by myself or someone like that. It is completely open in that sense. There's no levels, there's no hierarchy, apart from within your own organizations, of course, as there are in healthcare. I will come back and happily answer some more kind of questions later. But I just wanted to give you a bit of a flavour without giving you too much kind of detail at this stage. But I'm really, really super pleased and happy at the work that we've done over the number of months with the panel that I'm about to introduce on setting this all up and making sure it's nice and easy for you. So on that note, I'm going to pass over to Amna to begin with. I believe it is Amna, not Marina, who's going first, but correct me if I'm wrong, and please
No, it's me,
come in
Karl.
accordingly.
Thank you, Karl. Natalie, are we able to move 2 slides to the journey slide, please? No, yes, this one. Thank you. And thank you, Karl, for that introduction and I guess orientating the audience to how digital health networks fit and where the Digital Pharmacy Council comes together. And that lends me nicely to kind of share with you all the journey to becoming this Digital Pharmacy Council. I want to just recognise that before I started any of the work to move us to a digital pharmacy network, Ramandeep Kaur and Sarah Thompson did establish that sort of digital pharmacy network on the Digital Health Network's discourse page. So I wanted to just highlight that. And then a couple of years ago, I actually did a scoping exercise during my time at NHS England as a clinical fellow, and it was to review the current networks that exist in terms of those that are specific for pharmacy professionals and those that exist that are agnostic to what profession you're in, so medicine, nursing. And the purpose of that was to really understand what's already out there to support the profession in developing digital skills, but also in developing a community of practice, and to see that do we need to actually have a specific network that is open for all. So I did the review, and the outputs of that are actually on the NHS Futures, and it shares with you what networks actually exist right now and their purpose and their aims. And Rahul will touch on that later when he talks around where this all fits in terms of the national landscape. And then in 2024, a Digital Health Network kindly hosted a roundtable for us at Clinical Pharmacy Congress. And the purpose of that roundtable at that time was we thought it was a good idea to, actually start putting some momentum behind establishing a more formal digital pharmacy network. And it was to get people from across pharmacy, so the different sectors, academia, secondary care, primary care, bring them all around to have a discussion around if we did want to have a digital pharmacy network within digital health networks, what would the purpose of that be? Do we actually need it? And where's the gap right now? And what do we need to do to try and, I guess, close the gap? And as part of that, I reached out to representatives, like I said, across pharmacy and sectors to establish a core steering group. And I'm really pleased that some of the core steering group are actually on the call today. I know the cameras are off, and in the next slide, I'll introduce who they are and their area of specialties. But I am really grateful that people were engaged and gave their time to kind of get behind this and bring their expertise in really thinking about what do we want to achieve within the digital pharmacy network. And as part of that, one of the actions was to actually undertake a survey. And this survey was to make sure that we could reach a wider net and a wider representation. And it had to include, I guess, where you are in terms of your career, not just senior leaders, but also the early career professionals, to see, what would they want from this sort of network. So we have done that survey, and Shaz will share with you later the outputs of that survey. But I guess it was really fundamental in us being able to identify what the priorities of this network would be. And then in the last year, Marina, as Karl mentioned, has been looking at, building on that work and that momentum. And we hosted a second roundtable at Clinical Pharmacy Congress this year, again, hosted by Digital Health Networks. And this roundtable really focused on sharing the feedback from the survey with those that were able to represent. And we're really pleased that we were able to get representatives from the regulator, so the GPHC, and the APTUC, so the Pharmacy Technicians Professional Body, as well as academia, secondary care, primary care, and national representatives around that roundtable to have a really good discussion on what the priority areas. And AI was quite heavily one of the areas that was discussed within that, given what's going on in terms of that space around new innovation that's coming out. And the outputs of that, we have actually written a report. We're just we will be publishing that on Discourse and via the Digital Health Network. So hopefully that'll be out soon for you to have a review of the sort of discussion that happened and some of the actions that we've said we'll do following that roundtable. And one of this was around launching this formally. And then we've created a terms of reference, which will be uploaded onto the Discourse page. We'll talk about Discourse later on. So you can understand, I guess, just in terms of the governance process of this council, what it will be. And then the next steps, really pleased today, we've actually got the formal launch, and we're really happy and appreciative that Karl's come to actually officially launch the Digital Pharmacy Council, because, you know, this is quite a pivotal point for us. And also, as we established as Digital Pharmacy Council, Karl mentioned there's the Digital Health Summer School, that's this week, and we're actually representing that on a panel session. And this is really pivotal in, I guess, showcasing what pharmacy professionals bring to the table in that conversation, especially when we think about, you know, national policy, and we've got the CCIO and CNIO networks, and it's really key that we are involved in those conversations so we can have those discussions on, you know, what the needs are, and from our expertise when it comes to digital transformation, what the focus areas could be. So we're really pleased that we're able to represent at the Digital Health Summer School. Next slide, please. So as I mentioned, we have got a leadership and steering group committee, and you'll see those members on screen here. And I just want to say thank everyone, take this opportunity to thank everyone that's been involved to this point and to bring us to this journey, because it is taking people's time. People take time out to really become involved and give their time in understanding, you know, how we want to work as a council now. And we've got, you can see, a wide range of pharmacy professionals, and they've got different areas. Shaz will talk about our focus areas, but we've got Marina, Shaz and I who are looking at, you know, the coordination and governance of this group. Amita is actually the chair of the BCS Specialist Interest Group for Medicines. And again, this council is around working collaboratively with other networks that already exist, because we don't want to duplicate. Angela Bergin, she is our research and practice, that will be a focus area, and she's got a PhD by background. So again, we'll bring those expertise within this council. Anna works at the University Hospital Southampton and is focused in digital medicines in secondary care. Benedict represents academia, and again, that is an area that sometimes isn't always had the spotlight on, so we're really pleased that we can have Benedict join us as a steering group. Iblal will be focused on AI in pharmacy, and Jamie's looking at regional and primary care adoption of digital systems. Jonathan Bevers, Jono actually has his as a separate network for AI and a community of practice. And again, it's about working collaboratively across that within the Digital Pharmacy Council. So it's key that he's part of the steering committee. Liam was looking at digital medicines in secondary care. And then really pleased that Ramandeep and Yvette, who are already part of the Digital Health Network and the CCIO advisory panel, are again the link across digital health networks itself. So I hope you can see there that actually we're working collaboratively across wider networks, but also making sure that we maintain the priorities for pharmacy within all of that sort of discussions that do go ahead. Next slide, please. And Marina, I'll hand over to you.
Hi, thanks, Amna. So thank you so much, everyone, for joining us at this launch. But what is Digital Pharmacy Council? We need to understand that. So there are many professionals groups across health and care. They've already established route for collaboration, representation, and influence within this digital health networks community. So today, pharmacy is joining the community with their own dedicated council. So at its heart, the Digital Pharmacy Council exists because there are clear need for a stronger and more connected pharmacy community. Across pharmacy, there is fantastic work happening. We all know it's happening every day, but often those conversations are happening in isolation within individual organizations or sectors or regions. So for example, if one trust has successfully implemented a e-prescribing safety dashboard that has kind of reduced the omitted doses, there should be a simpler way to share those lessons nationally as well. Equally, if a community pharmacy has developed an innovative approach to triage or workflow management, others should be able to learn from that experience rather than kind of reinventing the wheel. So this council provides that national forum to bring those conversations together. So it works as a connector between all the different digital health ecosystem. We wanted to bring together as our aim to bring together established leaders and emerging digital pharmacy professionals from every sector of the profession. So we wanted to be as inclusive as we can, whether you're working and whether you're leading a national program, you're implementing a electronic prescribing solution, you're exploring AI, or just trying to be curious or learn about digital transformation of what it is. There is a place for everyone on this council to learn, collaborate, and contribute, basically. Of course, it's not only about networking as well, it's also about influence. So as healthcare continues to digitally transform, pharmacy needs to be part of those strategic conversations as well. So we shouldn't be responding after decisions have already been made, but we have to help shape them from the outset. So take example of the AI, which is these days quite a hype. AI will look very different for pharmacists than it will for radiologists or our nursing or our GP colleagues. We have unique considerations around medicines optimization, patients' prescribing journeys, or clinical verification, patient safety. So if those pharmacy perspectives aren't represented in those conversations, we're just creating solutions that are not going to work for the people using them or the patients that they're designed to help. So those differences need to be understood and reflected when the national policy and digital programs are developed. So the same applies for some areas in secondary care, such as interoperability or clinical safety standards, electronic prescribing, medicines data. So pharmacy professionals, as Amna has mentioned as well previously, we all know as pharmacy professionals, we understand medicines, we understand how medicines flow across care settings, the risk that can occur when systems don't communicate effectively. And that perspective is essentially when digital solutions are being designed and implemented, that needs to be considered. So this is what the council is about. It's about connecting the expertise, supporting one another, make sure pharmacy has a strong, credible voice in shaping the future of digital health. And that's why this council exists. So the next question is like, where do we want to go, and how we see the Digital Pharmacy Council developing over the coming months. So next slide, please. So although today is the official launch of our Digital Pharmacy Council, we see this as part of a longer journey. So our ambition is to build something that is sustainable, credible, and genuinely influential. And as you can see, the first phase has already been completed through the work of our core steering group. And this group has helped define the vision, priorities, foundations of the council, and they have brought together expertise from wider pharmacy sectors, as Amna has mentioned. So now we are entering the next phase, where the council is growing into a broader leadership community with representation from all different sectors, care settings, all career stages, and bringing that inclusivity into that. Our ambition for this Digital Pharmacy Council is to reflect the diversity of the pharmacy professionals as well. So from community pharmacy and primary care through to like hospital pharmacy, academia, digital health, and also the national organizations. So a longer term ambition within the next 6 months, and we are in conversations with the Digital Health Network, is to become a formally elected advisory panel, which is aligned to the governance models used across digital health networks. So Karl has mentioned previously, there's a CCIO panel, CNIO panel, and this is where we want to go up to. So this is a significant milestone because it gives pharmacy parity with these other professional groups which are represented within that digital health network structure. So it means when the national conversations are taking place about, say, AI or digital transformation, workforce capabilities, clinical systems, pharmacy has an established and credible influential voice contributing to those discussions. So say, for example, if a national program is developing a guidance on AI-enabled clinical decision support, the council could help ensure that medicine optimization, those prescribing safety, pharmacy workflows are considered because pharmacists are there at the table. So if there are new standards being developed for a digital medicine system, the council can then help bring together those practical expertise from across the profession to inform that work. So the thing is, achieving that vision requires more than a steering group. So getting there will take all of us. So it does require an active and engaged community. And we are already credible people being from the pharmacy profession, but this credibility in the digital health network will also come from participation, collaboration, and contribution. So it comes to members, our members, all of you, to share case studies, present your work, contribute ideas, help us identify what are the emerging issues which are facing the profession. Let's come together to solve all those things together. The encouraging thing is that the Digital Health Network has been incredibly supportive throughout the journey and have recognized the importance of that ensuring the pharmacy have a stronger voice within the digital pharmacy or digital health landscape. So this is the genuine opportunity for all of us to then raise the profile of our profession and also demonstrate the value our profession bring to these digital transformation. So with that vision in mind, we have to now look at where the Digital Pharmacy Council sits within the wider national digital landscape and how we complement the fantastic work already taking place across existing networks and organizations. So on this moment, I'll hand over to Rahul Singhal, who's our National Chief Pharmacy Information Officer, and he'll discuss a bit more about the national perspective. So over to you, Rahul.
Thanks, Marina. Thanks. Can you hear me okay?
Yeah, we can.
Yeah, okay, perfect. Yeah. And how long have I got? 10 minutes, or how are you doing on time?
Fine, Rahul.
Yeah. Oh, good. Fine, perfect. All right. So hi everyone. My name is Rahul. I'm the Chief Pharmacy Information Officer at NHS England. And really pleased that we're launching this Digital Pharmacy Council. So I think I just reflecting on what people said. If I just spend a couple of minutes just to give you my reflection, if that's okay, and then I'll go through this. I guess how we see it all fit. So I've been doing this for about 3-ish years now, and this is something that people have kind of asked. They've asked for things like networks. I speak to lots of pharmacy colleagues in different parts of community pharmacy, in primary care, in hospitals, who are at different points in their career. Some people are very well established in their roles and feel a bit stuck. They know there's so much opportunity, but they kind of only see a small part of it. They're thinking about starting their career in this space, or they've been kind of found in this space, but they're not really sure where to go. And I've always struggled to know where to send them to first, as a kind of a bit of a catch-all, so they can kind of hang out with like-minded people. Normally, and that's been quite difficult, and I think that's something that most can resonate with. So I think this council helps address that, really, because it becomes a bit of a kind of a foundational a network which is very inclusive. There's a low barriers to entry, low friction. You can enter it without any kind of overhead of applications or commitments. You kind of give what you can and you get out what you put in, type of model of practice. This is what this is. So really happy, and I guess in the context of that, I thought I'd talk to a little bit about kind of some of the other stuff that's going on that we're kind of involved in. I mean, the challenge with a lot of this stuff, and if you're like me, an internal kind of skeptic and always see the problems with things, right? You always kind of feel that sometimes you have to be really clear around why you're doing what you're doing and where do things fit, and sometimes setting up networks is part of the challenge, but maintaining them and having the activation and the resource required, that's quite difficult, having each of them with like clear purposes and kind of where they fit and the role they play. I haven't really read the chat properly, but I was just scanning it before I came on, and there are questions there around diversity, and I guess the kind of the group of individuals that have kind of provided some leadership to kind of get it to this point, and questions around representation, around diverse backgrounds, different sectors, etc. I think my kind of general comment around all of that would be, I don't think this network or this thing is about trying to get the right representation. I think this is really about being a catch-all for people to self-select themselves and show leadership and demonstrate that in the areas they can. I mean, I don't think I think all the people that are on that list so far are only there because they have kind of provided a bit of different activation energy and interest in those different areas. No offense to the people, they may not be the right people, they may run out of steam, they may have been in the wrong place at the wrong time and got collared into this, and they might regret being part of it as it starts. So I guess what I'm saying is just put yourself into it, because networks only work based on activation energy, in my view, and people driving it and posting and contributing and getting something out of it. If you post a question and you get an answer, you see value. If you post a question and nothing comes of it, then you start to feel like there's no value in it. So everybody's got to kind of participate in this and give it the energy. And I think the representation stuff will sort itself out if everyone kind of holds true to that, would be my ask. So just in the tapestry of networks, there's some things that we kind of support, and I kind of maybe where this fits. There's a bunch of stuff that we've got kind of going on that I would recognize as the networks we reach out to. And I kind of hold a group nationally, which kind of brings these different areas together. So it helps me, one, stay connected as best possible around the things we're trying to do nationally. So I've got the right insights, and we can get feedback and also like a dissemination layer of some of the information that we need to do. So I might get kicked out of this room in a second, so I'm just looking over there. So just very quickly before we, and then I'll pass on to pass back on, is so just to give you a quick tapestry of kind of the things that we're up to. So in NHS England, we have two kind of key things that we kind of do. So we have these kind of communication channels. We run something called a community of practice, which not many people on this call will be part of. It's mainly focused around suppliers and NHS Trust that have been working with us on our interoperability and medicines agenda. Some of you may be part of that. No, that's very focused. Suppliers and Trust to work together with us. And it's a really good forum that our product manager, Chris, leads. Does an excellent job of that. I run a kind of a national webinar that every couple of months. That was born out of feedback from pharmacy leaders, chief pharmacists, everything from EPMLEs to CPIOs and who felt they weren't connected to what was happening nationally or the national agenda. So we kind of structure those agendas where I kind of provide a national briefing around what's going on in the medicines priorities. And I also invite one of the other national programs, such as single patient record, I think was on it last week, to just kind of give people a more of a rounded a briefing. And then Amna and now Marina and the subsequent clinical fellows run the e-prescribing masterclass, which is a lot of you would have been part of that, which is around safety, optimization of UPMA systems. And just very quickly, one of the other gaps we had was regionally. We felt that as part of the kind of operating model, we wanted more regional leadership of CPIOs and digital pharmacy leads. So last year we ran a process of appointing 7 leads, one for each region, who are doing an excellent job, and that's kind of maturing. And each of them run their own kind of network, which are all kind of different maturities and operation. So we hear about the Pharmacy Council. The BCS have a well-established specialist interest group for medicines that's led by Mita. That's been running probably a lot longer, and that both provides leadership within the BCS as well as wider. The Royal College of Pharmacy, as it is now, as a digital advisory group, which I present at regularly. I know Amna's a member, Darren Powell leads that, and a few others. And then Community Pharmacy IT is not a group we have any, and the same with BCS and the Royal College group, we don't do anything for. But that's a helpful group for us when we want to do engagement with community pharmacy IT that we kind of recognise. I'll pause there, but I guess the idea of this is to say, look, this is like an ecosystem of networks. That's kind of how networks operate best. There'll be duplication naturally in the kind of conversations. We hope that will start to bubble up, that there's an interest in these areas, and we'll use this, as I was is the stuff, and just the stuff we're doing is really hard. Yeah, like it's really complicated. We're all, our resource doesn't match our ambitions on almost anything that we are trying to do. So therefore, we kind of really need to pull together on a lot of the things that we're doing. It's complex to change stuff. It's hard to keep up with the pace of technology. It's then hard to know the success and the opportunities for implementation, and then if you even get to that stage, to know if you're even doing a good job and if it's delivering the benefits that you want, to then be displaced by the latest technology and improvement, to then think about how you go again. So I think that requires a real team effort to do it, because no one is the global authority for technology innovation in the NHS. So people look to us and think it's me or us, and it really isn't. But we would look to these networks to really help us to drive a view on that. So thank you. Look forward to how this kind of progresses.
Thanks, Rahul.
Hi, next slide, please. Hi, so as Amna mentioned, we kind of conducted a survey to understand if there was firstly a need for a digital pharmacy council. Now, overwhelmingly, the response was yes. We need a digital pharmacy council, and based on my experiences, having qualified a couple of years ago, there wasn't really any platform at that time. Now, obviously, as the years have gone by, things are more developed and so forth, and it's how can we kind of support each other. And then what also that survey wanted to do was look at the kind of key focus areas that we would want colleagues to focus on. What do we want to achieve and how do we get there? So these were the 4 kind of key areas that were identified, and they're on the screen. But obviously, if there's any others, please, you feel that we've missed, please obviously drop them in the chat. We'll happily kind of have a look at those. But from the survey results, these were the 4 main key areas identified. So I'll go into each of these in a bit of detail. So AI in pharmacy. So AI is currently a buzzword, is mentioned in the 10-year plan. How can we kind of utilize AI? And the aim of this is to kind of look at discussing it with frontline users who currently use AI. So I know that there's been key pieces of work looking at AI in business reconciliation, AI in other areas as well. So the aim of this is to support those that are on the AI journey. So those that haven't started with the AI, learning from those that have kind of embedded AI in practice and how they're using it. By collaborating together, we can all upskill ourselves and make sure that we're kind of utilizing it as best as we can. So it's about kind of looking at use case scenarios, guidance. How can we work together collaboratively to kind of improve patient care? The next one is data analysis and research. So again, this is about using data to kind of support patient care. So one of the things that nationally is being worked upon is the single patient record. So how can we all, with our different systems and ways of working, how can we all kind of work collaboratively to achieve that national kind of aim of the single patient record? It's also about using data to improve EPRs. So most of my colleagues in secondary care will know about ePraise, but it's about kind of looking at how different systems are optimized and how can we learn from each other to get the best out of each other's systems. When I left one organization to join another organization. They both had the same EPMA, EPR, but they were using it differently. And it's about kind of looking at how, the second organization was struggling with it, and it's how then can we optimize it and learn using data from the first organization. So it's about learning from each other despite our different systems. There's also using data to kind of help support with research. So one of our kind of steering group members is Angela Bergin, who's on the call. She's an NIHR fellow, and she's done research on how EPMA changes behaviors. And it's about kind of bringing people together, learning from each other. What changes can EPMA bring? What are the good changes that we want to keep? What are the negative, disbenefits? How can we then work together to kind of build, minimize the disbenefits and increase the benefits? Going on to digital literacy and workforce development, our aim for this is so that it's somewhere to share kind of best practice support and kind of have a mentorship kind of place, so that people can link it together, learn from each other, support each other. The Royal College of Pharmacy, as Rahul said, and CPPE, Amna's done some great work kind of creating digital learning gateways. How can we signpost colleagues to that? How can we add more? Is there more research? Is there more kind of workforce work that needs to be done? Is there more literacy qualifications? The latest qualifications, what are they? How can we support colleagues? It's different in different organizations. Some are have great digital literacy. It's about supporting those that are not there yet. How can we kind of work together? And the other thing with digital literacy and workforce development is it's not just for pharmacists and pharmacy technicians. There's also our ATOs. There's also, I have the pleasure in our region with, we've got non-pharmacy colleagues working in pharmacy in the digital space. So it's about kind of having inclusivity for all, whether you're using a computer to label or whether you're using it for more complex things, it's still digital literacy. So how can we then support everyone? Digital resources. So our aim is that we kind of we'll put them onto discourse and guide people to these different resources so that it's centralized in one place. We kind of see it as a collaborative platform with other areas that are doing some great stuff like the Royal College of Pharmacy, as I mentioned, and CPPE. But it's also about kind of having those discussions, looking at standards. So there's a piece of work on 2D barcodes, the issues that we're all facing with 2D barcodes and them disappearing on certain medicinal packs. How can we kind of work together to kind of look at that on a national scale, but also looking at the recent kind of expressions of interest for the DCB standards, looking at how we can help suppliers as well as those kind of implementing systems. Next slide, please, Nat. Thank you. So there's different ways to get involved. Obviously, join the discourse page. There's a discussion forum there. You can create posts if you want to reach out to colleagues. The more the merrier. Different people will chime in and support each other. And as Rahul said, it's a group, made by us for us. So it's how can we support each other to kind of make this a success and support each other as well. There's also the ability to create blogs on areas of interest. So, how many times have we done something that's great but not had the opportunity to present it? So here's an opportunity for us. Best practices. Where can we share them? You can share them on the discourse page. Others can learn from us. You can create blogs. As Amna mentioned, we had a second CPC roundtable, and there's going to be a blog created about that. Another of our STEAM group members, Benedict, he did an article, looking at addressing AI education gap. How can we support each other and learn from that? But these things aren't, if you don't know about them, then you're not going to share them and learn from them. So it's about bringing that all together. Webinars, there's, as I mentioned, there's Rewired, there's talks, can participate in talks at conferences like CPC. There's round tables, posters, presentations. There's a whole different way of getting involved, and we have a passion for it, my colleagues, and it's about kind of spreading that passion and making sure that we are all kind of working together, sharing examples of EPR life learning. How can we support each other, but also helping raise the pharmacy voice in digital publications and the wider digital health network. There is a CNIO network which is growing rapidly. There's a CCIO network. It's time pharmacy had a voice and could convey that across to and work collaboratively with the other groups as well. Things are not centralized at the moment, and as a digital health council, we aim to kind of bring together things in one place and connect people to each other. So there's a QR code for the digital health networks discourse page. That's just the landing page for digital health networks, but above that is the link as well. So join our pharmacy council page. So that's where we're hoping to create these kind of platforms and share our resources and so forth. Next slide, please.
Thank you. So hopefully everybody understands a little bit more and is excited about this. And I think Rahul's touched on it pretty well there in terms of inclusivity. Is there somebody that looks like me on this? Is there somebody that sounds like me? Diversity is difficult in the NHS. With digital health, proactively, positively discriminate against the NHS workforce, in that it's often kind of white male of a certain age in digital. And we've always tried to give a more even platform. I think Rahul's point, though, is it's about participation. It's very easy to say something's missing, something's not there. What's much harder is to go online and post and share your knowledge and experience and continue to do that. And that is the value that these communities bring. And I use the word community as it's your community. The people on the councils, the advisory panels, the steering groups are people who are putting in extra time every single week, every single month to have meetings, to take minutes, to run surveys. Not everybody can do that. So they provide that top level benefits, and then everybody else gets that benefit underneath. The whole point about moving in the future to an advisory panel is that there will be elections. So therefore, you can elect the people that you want to be in charge of the movement moving forward of your community, of your network. You can decide what representatives you want to meet at the centre, who's going to speak for you. But you can all, no matter what level you are within your organisation or on your career path, can nominate topics that you want to discuss in the forum, and people can go to those. If it becomes a specialist group, which is not a specialist group of me and Marina just talking because we're interested in talking about something, it has to be something that has some teeth, otherwise it will quickly die off. So we try and have as much of those discussions in the single kind of discourse platform of the Digital Pharmacy Council, so everybody can see that. All discussions are archived, so you can go back into discourse in the back end and look at any discussion that's happened over the last 13 years. If someone posts up a CV of what a digital pharmacist or a chief pharmacist would want to look like, you don't have to repeat that exercise. You can go in and you can grab that as a resource. If someone wants to look at what a job role from a CCIO looked like 7 years ago to a month ago, you can look at the discourse archive and look at that. We also have a WhatsApp group for the individual kind of advisory panels and council members as well, so they can have discussions about what we do. We invite people from all of the panels to join our program teams to influence what we're doing on the Rewired program, on the summer schools. As I mentioned right at the beginning, we do facilitate meetings between ourselves, our members, the community, with people from the centre. So whether they've got something they want to present on a webinar, we then host that webinar, invite everybody to attend it. It's completely inclusive. We don't cherry pick who can join, who can't join. We have regular meetings with the centre and with those kind of lead chairs and vice chairs, etc. So if you want to have a voice, and I saw someone semi-cheerlessly added in there, will you be able to, as a group, influence suppliers and the rest of the community? The answer is yes. That is exactly one of the reasons why you do this. It is to have a single voice for an entire community rather than a single person's voice, which only goes so far. So that is one of the key points of this. It is about influence, it is about shared knowledge and bringing out that knowledge and skills for everybody. So I really hope everyone really embraces the work that's been done by your colleagues and really gets involved, gets onto discourse, has those discussions. There will be a series of webinars coming up as part of this. There will be discussions facilitated at summer schools. I mentioned in one of the comments earlier, happy to introduce Amna to Andrew Griffiths, who's the CEO of FedIP. So if you want to have a discussion there, Jan is also going to be at some schools, and we'll be able to meet Jan, who's part of the BCS. BCS is one of our partners, along with lots of other groups and facilities. So we are a kind of broad organisation. We don't shut people out for the sake of it. Someone also mentioned a comment there about funding. It's free, digital health pay for this, we pay for the technology. We're not a charity, we do have to pay our bills, but this is free, so therefore the council will remain. We're not going to remove this, we're not going to suddenly ask you to start paying. We do have previously got some funding from NHS Digital, then NHS England. That funding is no longer there. We secure funding for the wider networks through sponsorship from sponsors from the supply community that work in the digital health space. When we start these new councils or new advisory panels, we do not seek sponsorship, to give yourselves an opportunity to just grow as a community without any kind of external kind of influence or any kind of premeditated actions that need to be done. But if you're looking to do particular extra things, if you want to run events, if you want to get bursary funding towards attending summer schools or towards attending Rewired and things like that, those are the kind of things where we then seek extra kind of sponsorship from supply communities. There are terms of reference around them in terms of how they need to behave, along with the terms of reference for everybody in this community. People can't just publish marketing literature with kind of US-centric language, trying to sell you things. They can't be disparaging about other communities, other groups, other suppliers. So we try and manage it, but it is a group that you need to manage yourselves as well. And you get out of it what you put in. I will be around. I've been around a while, a number of years, over a decade, doing this kind of thing, along with John Hooksmire, who was originally the CEO of Digital Health. We are, we love this kind of stuff. So, if things come up and there are questions and there's changes of directions, myself and Natalie, who's on the call, who's been part of lots of meetings to set this up, are around to help and support you. So I really hope you see the positive of this launch, and I'd like to thank everybody for putting their time and effort in. Marina, Amna, Rahul, everybody else, Ram and Deep, who's been in the background, have been part of the community for a long time in that CXIO role. It is a fundamental thing that people do. We have people who give up their free time to do mentoring of the kind of new wave of rising stars, something that's open to you guys to do. We're not going to stop you doing it. If you want to do it, you've got skin in the game, please do it. I'll be quiet. Marina, I'll pass back to you for any final comments.
Thank you. I just wanted to say the council will become what its member make it. So together we have got this real opportunity to build this national community that would connect these pharmacy professionals, and then we can shape that future of pharmacy. So just wanted to touch on what Shaz and Karl has said, that there are plenty of opportunities to get involved from the very beginning. Following today's launch, we will be running a discourse training session, so everyone can make most of our online community. We'll also be hosting some other webinars where you get the chance to meet our steering group, engage with our focus priority areas. There are lots of questions in the chat that what about this, what about that. If you're interested in that, bring those questions, lead on it with your group, and then we'll make it happen. We'll have a tangible output at the end of it. So thank you so much for joining. And any final words from Rahul and Shaz? It's great.
I think it's just really key to highlight. There's just been some comments in the chat around seniority and the networks. And I just want to make really clear that the whole point of the Digital Pharmacy Council is it's not just for senior leaders, it's for anyone from any level of seniority to be part of the Digital Pharmacy Council, because it's really important that we have that inclusive feedback. And also, reiterating Marina's point, this council will only be as good as everyone that joins it. And there's been lots of ideas that have been put in there about what about AI in medical devices, etc. But what we need to do is actually have focused, tangible outputs and priorities of what we want to start with first, because there's so much we could do, but coming together as a community is really key in understanding, who's got the experience, who wants to lead it, because it's not just the steering group that's leading this, it's all of you that have taken the time out to join the call today. So I just want to really reiterate that, please do join the discourse page. As Marina said, we'll have some follow-up webinars and to really bring that engagement and get everyone working collaboratively and focused on what the next key priorities will be for the next 12 months. So yeah, thank you everyone for joining today.
Thanks. I'll just add a final. Thanks. Really good to echo everything that's been said. I was going to say also the others will have a view on how to take it forward, but picking one of those priority areas and kind of driving something through would probably help build some momentum and energy, and people will kind of see whatever's been talked about today will start to come to life. And I think there's something around, we've had this kind of debate internally when it's been set up, Marina and I and others, which is around think of it as in like there is an opportunity to have access. So these questions people are asking, like EPS, home care, AI, all these things, like we have a position on all of that nationally, and we have a view and we have insights into all of that stuff. So you don't have to rumble around with those questions anymore, or kind of rely on things being cascaded down by organizations. So it's quite hard to kind of stay afloat with all this information. So use the networks to know that they'll have an access to me, my function, networks and stuff like that, to kind of help kind of provide you some information on this sort of stuff. That's helpful. But also the impartiality of it in terms of helping us understand where we should be focused on, what could we do more of. And this is not an NHS England network or a Department of Health network. This is a network for professionals in the system. to do this. And I think there's some stuff about, you know, and I think don't worry about the kind of who's not involved and who can be involved. I think this is open to everybody. Loads of people work in the medicine space that have lots of contributions. All my experience in hospitals are, you know, all the even pharmacists, you know, make sure nobody feels like this isn't for them. I think this is anybody with an interest. I think that's probably for all of us to think through. But yeah, I'll leave it there. I'm saying the same things others have said, but I'll leave it there.
Yes, thank you, everybody. Is there anyone who'd like to say anything else? Otherwise, I'll wrap it up for everybody. But look, thank you for everyone for joining. Just to let you know, there's been over 170 people on the launch today, which is fantastic. So well done, everybody, for joining. It's a really good start. Even if half of you then start posting, asking questions like you have done on here on the network, then as Rahul's just mentioned, there will be people with answers who can support and help you along. There is training out there. There's people like James Freed, who's attending summer school, who runs the things like the Digital Academy and the digital workforce programs at the centre. So again, looking at where that kind of community digital work and support is needed, you are now in a wider ecosphere, and that will help. Okay, I will say goodbye. It's been a pleasure to host you, and I look forward to seeing more of you soon. Take care.
Thank you all.
Thank you, everyone. Bye.
Thank you.
Thanks.
Bye.